For more than 6 years, epidemics of cholera have extended throughout much of the Far East. In the summer of 1963, cases of cholera occurred in Thailand, and subsequently, the disease spread into Cambodia to the east. By the end of the year, unofficial reports traced the spread to the border of South Vietnam. On January 7, 1964, a patient died in Saigon with a cholera-like illness. No bacteriologic analysis was done. Within the next week, hundreds of people with symptoms of severe dehydration and vomiting were brought to the Cho Quan Hospital, the infectious disease hospital of Saigon. Between the 12th and 19th of January, 265 cases were admitted. 46 of these died. A culture analysis was conducted at the Institute of Pasteur in Saigon. The disease was diagnosed as Cholera El Tor, Ogawa strain. From the Pasteur Institute in Paris came a confirmation of this diagnosis. The number of cases began to mount rapidly, and in a short time, the wards of the Cho Quan Hospital were overfilled. Hundreds of children were taken to the Children's Hospital in Saigon. The mortality rate ranged from 20 to 30%. There was an inadequate amount of vaccine and medical facilities. Dr. Vuong Quang Trong, Secretary of Health for South Vietnam, and Dr. Horace Deline, Chief Public Health Division, AID, met and planned measures of halting the epidemic. The approach would be along 3 lines. First, obtaining vaccine and immunizing as much of the South Vietnamese population as possible. Second, obtaining an adequate quantity of intravenous fluids and other life-saving medical supplies. Third, bringing in an American team of cholera experts to treat patients and to train Vietnamese medical personnel. Several million doses of cholera vaccine were flown to Saigon from Manila, Tokyo, Hong Kong, and Calcutta. The immunization campaign was put into motion. Vaccine was rushed to specified areas of Saigon and the provinces. Local Vietnamese teams, together with AID personnel, gave anti-cholera inoculations in the streets and at strategically placed immunization centers. Armed forces personnel on duty in South Vietnam provided additional help, particularly in remote areas. Some 7 million people received anti-cholera vaccine. 3 million doses were given in Saigon alone. A campaign to alert and guide the public was directed by a team at the Public Health Division of AID. Thousands of posters were printed, telling of the importance of personal hygiene in preventing the spread of cholera. The message emphasized hand washing, the sanitary disposal of excrement, the eradication of flies, and the importance of such household measures as boiling all water and cooking foods adequately. Local health teams demonstrated the methods suggested by the posters. They visited homes, schools, restaurants, and street vendors, in each case showing the people what they could do to help check the spread of the disease. As a result, a general cleanup drive took place. Standing water was drained off, garbage picked up, and privies washed with a disinfectant solution. Because the water in Saigon and outlying areas was often inadequately chlorinated, samples were taken from various standpipes and tested for residual chlorine content. If the level of chlorination was found inadequate, trucks brought clean water for public use until the proper chlorine content could be restored. The people had been alerted to the probable causes of the cholera outbreak. They understood, and they acted. Because the effort to inform them had been made early, the people's response was effective. Along with the endeavor to control the spread of the disease, there remained the task of treating those already stricken. 450,000 liters of intravenous fluids were flown into Saigon and immediately transported to hospitals. These intravenous fluids, consisting of dextrose and water and a sodium bicarbonate solution, would be used to treat severe dehydration and shock, conditions resulting from the profuse diarrhea associated with cholera. Specially designed cots and other supplies arrived and were set up to accommodate the increasing number of patients. And to help take care of them, the Naval Medical Research Unit No. 2 was sent from Formosa. The unit was under the direction of Captain Robert Phillips, a renowned expert in the field of cholera. This group of 11 men consisted of physicians and medical technicians. They had developed a number of modern techniques of cholera treatment. They would not only apply these techniques, but train the Vietnamese in their use. They established a base of operation at the Cho Quan Hospital, where the first task was to calculate the amount of intravenous fluid needed for each patient. The method consisted of weighing each patient on entry and taking blood samples which were used to determine blood electrolytes and blood urea nitrogen. Next, they centrifuged the samples and measured the specific gravity of the whole blood in a copper sulfate solution. Using a formula devised by Dr. Phillips, they were able to estimate the amount of fluids to replace during the first few hours of therapy. A severe complication of cholera is acidosis. To overcome this, blood was tested for pH, and a dosage of bicarbonate was computed. From then on, a strict intake-output chart was maintained by hourly measurements. The naval team was also conducting an evaluation to determine whether or not cholera victims could be adequately treated with special oral fluids. This was of particular importance to those concerned with treating patients in the countryside, where no intravenous facilities were available. The Vietnamese nurses and doctors learned the methods of the naval team and were soon applying them in other wards. The U.S. Public Health Service sent Dr. Charles E. McCall and Mr. William T. Martin to gather bacteriological specimens and sera for study at the Communicable Disease Center. They also observed the epidemic and brought back epidemiological statistics and a report of the clinical methods used by Dr. Phillips' unit. With the arrival of the naval team, the mortality rate dropped from 20 or 30% to less than 1%. By the latter part of February, the epidemic in the city of Saigon was under control. In the provinces, accurate information was not available because of the military situation. But modern methods of treatment had saved thousands of lives, and quick action from the outset had prevented the spread of the epidemic. Because of the training they received, many physicians and nurses in South Vietnam are now prepared in the event of another outbreak. In the troubled land of Vietnam, this example of international cooperation remains as a poignant reminder of the better efforts of man.